Hi guys, we have Carole here who had knee stem cell injections about 6 weeks ago. She had severe tricompartmental arthritis in her knee, which is the right knee, and also meniscus issues on the medial side and ACL and PCL laxity. So she had all these injected intra-articular stem cells along with medial meniscus and also the ACL and PCL. This was done under fluoro guidance. It's been 6 weeks. Let's find out. Carole, how are you doing after the procedure?
I'm doing fantastic.
And
I can now walk. It was becoming debilitating until I came to see you, and then if you did the procedure, the first couple of weeks were a little, but now I'm going to say after 6 weeks, it's about 80%. And I'm getting around a whole lot better than I used to. I can now stand up without an excruciating pain.
what else can you do without pain, Carole?
Pardon me?
What else can you do without pain?
I can do a whole lot of things. Yes, I can still go out with my grandchildren, and I go all over the place with them, and I go on some trips, and that's what I want to continue to do.
And what about your range of motion? Any improvement there?
Yes, yes. The range of motion is very good, on this knee. Okay.
And what was the percentage relief you got from the procedure?
After the procedure,
Like compared to your pain before to now, how much better are
pain
you?
before was I don't, but with that now, as I said, I'm operating on 80% now. I still have a way to go, a little way to go, but I'm going to try to be patient, and it'll get there.
Are you glad you got this done?
Pardon me?
Are you glad you got this done?
Yes.
Awesome.
Oh, absolutely, absolutely. Now that I can go continue to do what I used to do. I love to work. I love to exercise. I love to do all that. And, I want to stay independent. I'm not getting any younger. Thank you for that.
Awesome. I'm so glad to hear that. Thanks, Carole. Take care.